Hello and welcome to session 2 of the AS Psychology catch-up sessions. In the last video, I spoke to you about the assumptions of the approaches with some exam technique, and today we are going to move on and we're going to have a look at some evaluation questions, also some content from the biological evaluation, and also some exam technique as well. Okay, so starting off then, for each of the approaches, and remember that there are 5 different approaches, you will need to complete 2 evaluations. The first evaluation will be for the study that you look at within that approach, and the second one will be for the whole approach, summing up everything that you have learned and you have looked at. Very, very important, because evaluations are always one of your highest marked questions that you will get on the paper. So it's really important that we feel confident with how to answer these questions. You can be asked to evaluate the approach and the study just on its own, just evaluate the biological approach, for example. Or they can ask you to look specifically at strengths and weaknesses. Some questions sometimes say, consider or describe just the strengths of the biological or whatever approach, or just the weaknesses. So it's making sure that we feel confident to answer lots of different types of questions, but still using the same content that you're taught in your evaluation lessons. With this as well, you can use anything from the approach and bring that into your answer. It's really important in gaining marks and moving yourself up the mark band. And then, as always, it's using appropriate terminology, and especially within evaluation questions, that's really when you can use your terminology appropriately. It also is where you cross over a little bit with Unit 2, with your research methods unit, and you can bring in some of the terminology that you learn in that unit as well. Okay, so we're going to look at evaluating the whole approach, and like I did with the assumptions, I'm also now going to talk to you about the biological approach and how we're going to evaluate the whole of the biological approach. So I'm going to give you the content first. Once I've gone through the content, we are going to have a little look at how to write a question, how to plan the question, and then I've also got some example evaluation paragraphs as well that we can have a look at and use for revision. So we are evaluating the whole of the biological approach today. Now, terminology recap. I go on a lot about how important terminology is in your answers. It really shows a knowledge of psychology and a sophistication of your answers if you use as much terminology as possible within your answers. So the list that's on the screen that you can see now are all different terminology that I am going to use within the content section of this presentation. So starting off with the word scientific. Now, scientific means that something is either done with a scientific equipment, so equipment that looks into the brain, or it is something that is controlled, and something that can be standardized, so something that is the same for everybody. Now, in the biological approach, they use PET scans, they look at injecting tracers, and they use very consistent scientific methods. So this is a really good approach to use if you're going to talk about scientificness, because we know that a PET scan, for example, can't be faked or it can't be manipulated. You can't think really, really hard and change the structure of your brain. So it's a really, really good way of getting quite accurate results from something. The next word down is objective, and that kind of blends itself a little bit in with something being scientific. So if something's scientific, it is also objective, which means that it doesn't really have an opinion. Nobody can be different from each other. It is what it is. So that's objectiveness. And then opposite to that is subjective. Now, subjective means when something is open to interpretation from lots of different people. Okay, so for example, happiness may be a subjective thing that people have, because what makes me happy may be very different to what makes you happy. So subjective means it's open to interpretation, and it could possibly be quite different for everybody. Okay, then we've got determinism / free will. Now, if something's deterministic, it means that it is determined by something that is outside of our control. So in psychology's case, we're looking at behaviour. So it means that behaviour is determined by something outside of our control. So, for example, your genes and your hormones, you can't really control. They determine your behaviour. So the biological approach is very deterministic. The opposite of that, as you can see on the screen, is free will. Now, free will is that you choose how to behave. You have the choice, you make the decision. The next one down then is successful applications. And successful applications basically means that we are looking at ways in which we can apply what we know to a wider... Oh, sorry. Something's come up on my laptop. Oh, there we go. We can apply what we have learned within the approach to a wider setting. So, for example, if it's a part of psychology has helped us to understand something, then it has a successful application. It can be applied elsewhere outside of just within the approach of psychology. Then we have got reductionism and holism. Now, reductionism means like if something's reduced, if there's a reduction, it means that there's less of something. So it means that your behaviour is reduced down to just a certain few things. Again, for example, in the biological approach, they say that all behaviour is driven by our brain and our biology. So it reduces it down to something small. Whereas we know actually there's quite a lot of different things that influence our behaviour, and it can actually make us behave in certain ways. So it's a negative of the biological approach, but a really, really good word and key term to use in your answers. Then you've got holism, or if something's holistic. And holistic is the opposite of reductionist. It looks at the whole of something. It looks at every single thing about that person to determine why they behave that way. Next, we have got nature, nurture, and that is a debate that obviously is very, very apparent throughout all of psychology, especially within this unit. And nature and nurture are, again, opposites of each other. Nature is us, is what's inside of us. It's our biology, it's our genetic makeup, it's our brain, neurotransmitters, hormones, our genes, things like that. And nurture is all to do with our environment and our upbringing. So what's happened in our environment that may have influenced our behaviour. And then lastly, we have got individual differences. Now, individual differences is also known as something called nomothetic. And individual differences basically means that everybody is different, because everybody's upbringing is different and everybody's life experiences are different. And has psychology considered that as something in their evaluation or in their research? They are all key terms that definitely we need to be aware of. And when you're writing key term glossaries, if you're going to start off your revision, this is always a really, really good place to start. So you know the key terminology that you are going to be using in your essay questions. Okay, so looking at the biological approach then, we've got two lists here. Okay, we've got our strengths and we've got our weaknesses. So the strengths of the biological approach are that it's scientific, that it's determinist, and that it has successful applications. And the negatives are that it's reductionist, that it looks at nature and it doesn't look at nurture, and that it ignores individual differences. So I'm going to talk you through each one of those, and then we're going to have a go at putting one of them into a essay style sort of paragraph. So starting off with the strengths then. So the first strength, and I've spoken a little bit about this already, is that it is scientific, okay? It's an objective way of looking at behaviour. So unlike the other approaches, it deals with clear variables that are measured in a lab. We know that Rain's study uses PET scans, and PET scans are really reliable. They can be really easily replicated. And he used a peel and box technique. He got 10 horizontal slices of the brain, and that really allowed us to see inside the brain, and we could compare elements of the brain between the different participants, and things can be compared and checked, which really increases the reliability of the research because it is so scientific. So that is your first strength. Second one is that it is deterministic. Now, determinism, like I said before, is the ideas that behaviour is governed by factors that are completely outside of our control, like, for example, our biology. We can't control it, okay? We can, take medication that may make us feel better, but ultimately, neurotransmitters, genes, chemicals in our brain, we can't control. But one strength of this is if we know that one feeling, one thought, one emotion is determined by something, then we are able to treat people with that abnormal behaviour. So, for example, if you do not have enough serotonin in your brain, the neurotransmitter serotonin, you are likely to have a very low mood, which may lead to depression. Now, if we know that, because we know low serotonin equals depression, we know that to treat somebody with depression, we just have to give them more serotonin. We have to give them a tablet that increases the amount of serotonin in their brain. Similarly with schizophrenia, which we spoke about last time, people with schizophrenia have too much dopamine in the brain. So we need to dampen that dopamine down. So it's really handy that we know that behaviour is determined and what determines behaviour, because it means that it can help us with treatment. Okay, and then the last strength here is that it has successful applications. So for psychosurgeries, if you've looked at psychosurgery instead of drug therapies, capsulotomy is used for OCD, and it was shown in a piece of research to be 67% effective. Okay, so it is used and people have benefited from it, which means it's been quite successfully applied to something. And then drug therapies have also been hugely successful in treating disorders. So SSRIs for depression, which I've just spoken about, and lithium for bipolar disorder. Verguera reports that over 60% of bipolar patients showed improved symptoms when taking lithium. So that is successful. It's been applied to different types of disorders that have affected people, and it's had a positive benefit on them, which is really good, and definitely adds to the credibility and the positivity around this biological approach. Okay, so now looking then at the weaknesses of this. So there are, again, 3 weaknesses. First one, it's reductionist. Okay, so remember me saying before, reductionism, it means it's being reduced down. And it says that biological explanations are reduced down to a set of simple explanations. So, for example, Rain's study implies that criminal behaviour may have a biological basis. However, it overlooks the other factors that contribute to crime, such as poverty, family stress, and IQ. Now remember, the opposite of reductionism was holism, and if we were to make this study holistic, we would have to consider more things and not just biology. So we would maybe look at, where do they live? Do they live in poverty? Have their family, you know, has there been any trauma in the family? How do their parents bring them up? How clever are they? What's their IQ? What are their friends like? You know, how much money do they have in the family? It's all things like that that could give us more insight into their behaviour. But Rain and the biological approach didn't look at that. He just focused on the biological aspects, and that's why it's reductionist. The next one we have then is it only looks at nature and not nurture. Similar to the reductionist point really, but this one is looking at it from a different way, I suppose. It says the biological approach looks only at nature and not nurture. It doesn't look at how people think and feel. For example, the biological approach believes schizophrenia is caused by raised dopamine levels, which I've spoken about before, and then it attempts to treat that person by giving them drugs. But what it doesn't do is sit down with the patient and say, right, how does this make you feel? Is there any way we could do therapy? Is there anything we could change within your, you know, your house, your home, things that are going on socially in your life? It doesn't look at that. It just looks at it from a biological nature perspective. And realistically, in psychology, what we really want things to have is to look at both of those. Okay, so nature and nurture. Okay, and then lastly here, we have got individual differences. So the biological approach is known as something called nomothetic or nomothetic. Now this is a keyword that I didn't put in my keyword list at the very start of this video. But it basically says that it aims to make generalizations about people and therefore tends to ignore the differences between individuals. Now, most research tends to be male participants, okay, and that may be because the female hormone cycle interferes with biological systems. So depending on where they are within their menstrual cycle, or their hormones may influence how they are feeling and how they are thinking. So it's sometimes seen as easier if men take part in the research because they don't have that sort of disparity and that up and down in their emotions and their hormones. But we know that that produces a really invalid picture of behaviour, because what they are doing is, you know, they're ignoring the fact that everybody is different. They're taking research that was done on male participants and they are projecting those results to everybody and to women and to females. So a gender bias, and especially male bias, is really apparent in the biological approach. Now also here you can bring in what you know about Rain's murderers. You know that there were 39 men and only 2 women, so that's a really clear statistic that you can bring in to back up this point here. Okay, let's have a look at the mark scheme. So the question that is on the mark scheme here is analyse the strengths and weaknesses of the psychodynamic approach. And I'm very aware that I haven't spoken to you about the psychodynamic approach, but I just want you to be aware of how the mark scheme looks to an examiner and the terminology that they use within the bullet points. So I know that this isn't necessarily relevant for the content of the biological approach, but it does say things like deterministic, idiographic, unscientific, takes into account nature and nurture, therapeutic methods, and then it says comparison with other approaches and any other appropriate analysis. So all we are given content-wise when looking at the mark scheme for this answer are the key terms. So that just shows how important it is to make sure that you are getting that key terminology in your answer. Okay, and then this is the next part of the mark scheme, I've basically just split these two to get apart. Now, this is not specific to the question, and every evaluation question, if it's a 10 marker, the mark scheme will look like this on the screen now. Now, we'll start from the very bottom and we'll work our way up to try and figure out what's going on here. So, you will get 0 marks for an inappropriate answer. Now, inappropriate may mean that you may be asked to evaluate the biological approach, you might evaluate the cognitive approach, okay? It's inappropriate, it's not right, you've not read the question correctly, okay? So you would probably get a 0 for that. You would also get a 0 if you do not attempt the question and you leave it blank. But good exam practice is never leave a question blank, just give it a go. You might at least get some marks, even if you're completely stuck and you feel stressed out. Trying your best to answer every question is really, really good exam practice. Then the next mark band up is 1 to 2 marks. Now, superficial analysis is made of the strengths and weaknesses. Superficial, not great, thrown away comments, not really backed up with anything, not very strong comments. Sometimes they're a little bit correct, but they're a bit silly, things like that. Or a very, very basic analysis is made of the strengths and weaknesses. It's a little bit all over the place. It's quite sort of muddled and a bit confusing. And then the last bullet point, which is a really interesting one, it says no conclusion. Now, if we look, I'll come back to the conclusion thing in a minute, but if we look at 3 to 5, it says basic analysis is made of the strengths and weaknesses. Reasonable analysis is made of the strengths and weaknesses. The comments are generic and not appropriately contextualized. Now, what that means is that you're not giving any more information. You're not bringing in things that you know about the approach. You're not backing up your answers with anything. Depth or range. So depth is obviously detailing your answer and range is talking about lots of different things. Structure is reasonable and a basic conclusion is reached. Now, in an evaluation question, if you do not conclude because you either forget or you run out of time, you will see here, you will only get 1 to 2 marks in that question because that's what it says there. A basic conclusion is reached. Well, if you've not written any conclusion, then a basic conclusion isn't reached. So you will probably get 2 marks. If what you've written is extraordinary and it's a really solid answer, but you've missed off a conclusion, maybe if the examiners are feeling nice, they could stretch it to the very lower end of this mark band and you could get a 3 marks, but it just shows how important it is to conclude. Now, I'm not talking about conclusions in this video today, but in session number 4, I am going to speak about conclusions and how important they are, especially for evaluation questions. So I will definitely come back to that. Then we've got 6 to 8. So reasonable analysis is made of both strengths and weaknesses with well-developed, balanced arguments. So you need to be able to talk about strengths and weaknesses. If you can only remember strengths, I mean, oh, that's good, but it doesn't show range in your answer. They show relevance to the context. So that's, again, elaborating on what you're saying. Structure is logical. Depth and range are displayed, but not in equal measure. So you may go into loads of detail, but not about very much. And then a reasonable conclusion is reached based on the evidence presented. So there's your conclusion again. And then we've got the top mark band, which is obviously where we're all aiming for. And this says thorough analysis is made of both strengths and weaknesses with well-developed, balanced arguments. Evaluation comments are clearly relevant to the context. The structure is logical, and I'm going to talk you through the structure in a minute. Depth and range are displayed, so both. An appropriate conclusion is reached based on the evidence presented. So you can see there how it develops and how it gets more and more and more marks, but also the things that are really, really important. Okay, so looking at both strengths and weaknesses and providing that detail and that context to your answer, and of course, conclusions. But like I said, I will come back to conclusions. Okay, so how are we going to plan this answer then? This is the structure that I teach the students that I teach in my school, and I find it really, really useful. So we always use the peel paragraph, which may be something that is used in other subjects as well. So we start off by looking at the point. What is the initial strength or weakness? What you're wanting to say, okay? And that's always a really nice start to a paragraph. So one strength of the biological approach is it's scientific. Great. You've made a really clear point on what you are going to be talking about. Second thing then is evidence. So what can you bring in from the approach to back up your point? If you're going to say the biological approach is scientific, why? Tell me why. What does it use that's scientific? Okay. That kind of leads us on to the explain part as well. So can you go into any more detail about your answer? What would this mean for the approach? So it's really scientific because it uses PET scans and it uses injections of fluorodeoxyglucose. Okay, why is that good? Give me more. Why? Because it cannot be manipulated and it cannot be it cannot be changed. It's a really accurate measure of the brain, things like that. And then lastly, we always do the L as link. Link your point back to the question. Why is that a weakness or a strength? This is a strength because if your research is scientific, it adds to the credibility of it. And it also means that your research can be replicated, which can improve the reliability of your research. So you're almost sort of looping back to the point that you're making in the first place. So you've said your point, you've got your evidence, you've given a really chunky explanation as to why that is a strength or a weakness, and then you've linked it back to the question. If you were to follow that each time for each strength and weakness, you will be on to something really good here. Okay, so what I would like to do is have a little go at showing you an answer that I have written. So on the screen, you can see this is the plan that I have just talked you through, and this is an example paragraph. So it says a strength, so point first, a strength of the biological approach is that it is scientific. The evidence. Unlike the other approaches, it deals with clear variables that can be measured in a laboratory. The use of PET scans is also reliable and can be easily replicated. The use of peel and box technique in RAINS allows brain scans to be compared and checked. Then we've got explained. So can we go into any more detail? Using the PET scan will ensure that RAINS research is scientific, as a PET scan cannot be manipulated and changed by the participants or the researcher. This means that the results are accurate and not influenced by the participants or from researcher bias. Similarly, the use of an FDG injection allows the researcher to understand areas of the brain that are active. This is an objective measure. Okay, and then we've got link. This is a strength because it means that the research is objective and adds to the credibility of the research. It also means the research is standardized and controlled, which can help with reliability. This is a nice answer, okay? This is a solid answer. There's a few things that we could add. So unlike other approaches, if we go back to here, comparison with other approaches is a point that could come up. Okay, so it's definitely something we could talk about. So unlike the other approaches, such as the psychodynamic approach, and we could talk a little bit about the psychodynamic approach here, that would really, really show our knowledge. But apart from that, there's lots and lots of use of key terms. So if we go through this paragraph and start to identify the key terms that they've used, so they've said scientific, variables, lab, PET scan, replicated, you've got your peel and box technique, manipulated, researcher bias, objective again, credibility, standardized, controlled, reliability. They're all psychology specific terms. So you're showing the examiner that you really know what you're talking about. Okay, so this is a really nice point. It's difficult to say what mark it would get because obviously it's not a full essay, but it's a really, really solid start to an essay that could be really good if it also had a conclusion on it as well. So if we have a look then at the mark scheme, so reasonable analysis of made of strengths and weaknesses. Now with this is only a strength, isn't it? So that's quite difficult to look at. They show relevance to the context. Is the structure logical? I would say yes, it's very relevant to the context because you're bringing in PET scans and the FDG injection, and you're talking about RAINS research. So yes, I would say so. Is the structure logical? Yeah, it's followed that point evidence explain link, so it's really nice and clear. Depth and range are displayed. Now range is difficult because it's only one point that we're making here. But I think, you know, we are sort of starting around here to make some sort of really good progress with that evaluation paragraph. So I hope that's really helpful, that you can see that in practice after we've just been through the content of the approach. So just want to go through some top tips with you guys. So the evaluation questions are usually ranged between 8 and 12 marks, which are our highest marked questions, remember. You can be asked to evaluate the approach / study and look at strengths and weaknesses. Examples, really important, and like I keep saying, appropriate terminology throughout. And then these sort of 6 points I think are the most important. So it must be balanced. Make sure you have strengths and weaknesses. Some approaches really difficult to do that with. The psychodynamic approach, there aren't that many strengths, but we've got to try and find some so that we can really show the examiner that, look, we know what's wrong with it, but we also can identify what's good with it as well. You must conclude, exclamation mark, exclamation mark. Use the peel to ensure logical structure. There is evidence from the approach used and explained. Bring in what you can, okay? I always say to my pupils, squeeze the sponge, squeeze everything you can out of your brain that you know about the biological approach, okay? Show off to the examiner on what you know. Make sure that there is depth and range. So for depth, it's adding detail. For range, it's making sure that you don't use quite simple evaluation points. So for example, one evaluation point is that there are, it's got a gender bias because there are more men than women. And then the next one, you can't really say, oh, another evaluation point is that it's age bias because the mean age was this. They're a bit superficial. You're not really delving into strengths and weaknesses and being very evaluative. So making sure that you use those terminology that we looked at the very beginning. And then, like I said before, session 4, we are going to cover conclusion. So you'll feel hopefully a little bit better about how to structure a conclusion after that. So you're going to need 2 evaluations, one for the study, one for the whole approach. Top tips are making sure you've got examples, using terminology, and making sure you have a really logical structure in your answer. Revision tips, make that keyword glossary, that little list I went through with you at the very beginning, really nice refresher, something that you could look at regularly and just define, whether you write it down or speak it to somebody. Create that mind map of information of what you know and what you don't know, so you can go back and make sure that you are covering everything. And then write little paragraphs like I've done in this presentation. Peel structure to write up small paragraphs, get your teachers to mark them possibly, and make sure that you are always going through your answers. Have I put a point? Have I put an evidence? Have I explained it? Have I linked it back to the question? It's a really good way of making sure you get right up that mark band for questions like this. So that is the end of the section on evaluation questions. The next session, we are going to look at relationship formation questions and the exam technique that goes along with those. And then session 4, will be content covered from all 3 sessions, but like I keep saying, we are going to include conclusions in that. Thank you very much for watching. I hope that was helpful. Diolch, and I will see you in the next session.